Everyone. Let me just get my screen put up so we can have the presentation. One moment. All right, hopefully everyone can see the screen okay. Oh, sorry, one moment.
Well, now we see us all again. We lost you. Lost your screen.
Okay. You good now?
Yep, that's good.
Awesome. Okay. So hello everyone, good evening. And I'd like to start off by giving a big thank you to Eisenhower Public Library and Penny and Kat for having me come speak in this virtual space. But most of all, I'd like to sincerely thank each and every one of you, whether you're joining us live right now or you're watching this afterwards, for being here and taking a listen to this information. So this program is called Transgender 101, and I'm going to do a presentation with slides, and we will do a Q&A at the end with the chat, and I anticipate that this will last about an hour or so. Let's get started. So I hope that we can all align with a few working agreements for tonight's presentation. Number one is that we're all here to learn something. It's okay if you don't know. Please be honest. You won't be judged or criticized if you don't know something. Number two, assume positive intent. This means I will operate under the assumption that everyone here is coming from a place of respect, and you can assume the same of me. And that's the only assumption we'll make here. And lastly, keep an open mind, challenge the way you think about things, and whether you're already familiar with this topic or not, I genuinely believe that you will learn something new and gain valuable insight from our discussion here. And lastly, as I mentioned, we'll do a Q&A at the end. So please save all of the questions for the Q&A at the end. And if something urgent comes up or there are technical issues, feel free to utilize the chat function. Otherwise, the mics will be muted throughout the duration. So I didn't introduce myself. That's okay. Let me do that. So as you can see, my name is Nikk Cochran Selik. My pronouns are he, him, and I've been a consultant and speaker for over 10 years, and I am an expert on transgender identity, transgender expert. So I was born and raised in Metro Detroit and moved to Chicago when I was 18, and I lived there up until last fall, when my husband and I relocated to Boston. I originally moved to Chicago to pursue a Bachelor of Arts degree in film from Columbia College. And during my junior year in the fall of 2008, I came out as a transgender man. I was 20 years old at the time. About 2 years later, I began sharing my story publicly, and thus started my career as a speaker and consultant. Since then, I've spoken to numerous organizations, conferences, businesses, schools, libraries, and families across the country about what it means to be transgender. In 2016, I founded TMAC, Transmasculine Alliance Chicago, which I'm proud to say is actually now one of the largest trans-led organizations in the Midwest. I served as the leader of TMAC for 5 years while volunteering at the Center on Halsted in Lakeview. During that time, I facilitated our meetings and presented on topics that were educational to our community. We even got to march in the Pride Parade a couple times with the Center on Halsted, and the photo is from Pride in 2017 with TMAC, so it was a really fun time. Additionally, I have experience working with parents of transgender youth, as well as the kids and teens themselves through Lurie Children's Hospital as a volunteer in their Trans Mentor program. I've also worked closely with Northwestern Medicine to develop their Gender Pathways program, as well as facilitate transgender competency trainings for their staff and providers. And lastly, in 2018, I was selected for the Windy City Times 30 Under 30 Award for my contributions to the LGBTQ community in Chicago. In my current role here in Boston, I'm the coordinator for a national program that's aimed at expanding access to gender-affirming healthcare in rural areas of the country through providing education to clinical and frontline staff at health centers. So enough about me. Now that you've met me, I'd like to introduce you to my family. So on the left is a photo of me with my mom, dad, and sister from 2001. I was in middle school. And then on the right is all of us at a Detroit Lions game in 2015. I remember when I told my family that I was transgender for the first time, and I knew they didn't quite understand everything, but the really important thing is they told me that they would still love me no matter what. And just as my transition was a process, it was also a process for the rest of my family. It took a bit of time, but everyone came around eventually with calling me Nick and using he, him pronouns for me. I know I wouldn't be where I'm at today without the love, support, and patience of my family. And I genuinely hope that by sharing my experiences with you, that you can learn from us as well. So in the process of understanding the meaning of transgender and what that's all about, we need to start by unlearning some of the associations we have between the concepts of sex and gender, namely that they do not mean the same thing. They're not synonyms like we were taught back in grade school. So let's start with something we're all familiar with. When a baby is born, the doctor says it's a boy or it's a girl based on the baby's anatomy. And then that male or female label is stamped on the baby's birth certificate. And this is supposedly who they are and who they will be forever and ever and ever. So we're all taught that our anatomy, namely our genitals, determine who we are for the rest of our lives. And perhaps it sounds a bit silly when I put it to you that way, but this is a practice that we as a society abide by. So sex is more accurately defined as assignment of male or female at birth based on anatomy. One thing I did want to mention too, when we use the term assigned sex at birth rather than biological sex, we are acknowledging that someone else is making this decision for us based on our bodies and our genitals and assigning us this label. So, okay, so going to the other one, here's what's interesting with assigning someone male or female at birth. We still do this even though we know that roughly 2% of people are born intersex. And intersex means that the person is born with one of many possible variations in chromosomes, hormones, and or genitals that do not fit the typical definitions of male or female bodies. And this is not the same thing as being transgender, which of course we'll talk more about that one in a bit. But it is important, however, to note that intersex people do in fact exist, which means inherently that the practice of assigning everyone as at birth as only either male or female is not 100% accurate for everyone. One moment. Unfortunately, it's not 80 degrees here in Boston, but I wish it were, pretending it is. Okay, so the terms sex and gender. So again, they're not the same thing. They're used interchangeably a lot. But gender, talking about that one now, is a bit more difficult to define than sex because it is truly a very complex and multifaceted concept. So in order to define it, it's best to break it down into three components, which are gender identity, expression, and roles. We'll go through each of those. Gender identity, the first one, is a deeply held internal sense of self as being male, female, both, neither, or somewhere in between. And it's okay if the last part, talking about being both, neither, somewhere in between, doesn't make sense to you right now. Just stay with me and we'll again talk about that part in further detail shortly. The key concept for now is that gender identity is how you experience yourself and who you know your authentic self to be on the inside. And lastly, although we use the word identity, it does not mean that it's a choice. It's a very key distinction. The word choice implies that, or I'm sorry, the choice, the only choice really is whether to acknowledge, who we are or not, which arguably is not necessarily a choice. So yes, that is gender identity. And then we have gender expression. So this is basically how we show our internal our gender identity on the outside. And we present this mainly through things like appearance, clothing, hair, behavior, mannerisms, all of that. And little kids know the concept of gender expression very well on a rudimentary level. If you ask them, oh, dress and long hair equals girl and pants and short hair equals boy. So notice that we have these existing associations with how someone should express their gender as well. Which leads to my third one, gender roles. And this is a set of behaviors and expectations learned by a person as appropriate to their gender. So again, from the moment we are born and we are assigned male or female at birth, we are then taught to behave like a boy or girl. And this is heavily reinforced throughout early childhood and adolescence and kind of forever. I don't really know when it ends. We live in a very gendered society. And that brings up an important point that gender roles are not necessarily universal. They're influenced by cultural norms. So that acknowledges that our current expectations for men and women here in the US in 2022 are different from other cultures around the world and throughout history. So again, they're not universal, same across the board, always and forever. This photo here demonstrates the ever prevalent belief in our society that all people are to be categorized as being either male or female. And this is known as the gender binary. The problem, of course, with the gender binary is that, as we mentioned, not everyone in the entire world fits these rigid definitions of male or female. And not fitting neatly into either box can make some things most people take for granted, such as using a public bathroom, a very difficult endeavor. Most people in the world are cisgender. Hopefully you've heard this term before. If not, I'm honored to be the one to teach it to you. But cis, CIS, is the prefix that means same, like in chemistry. And if a person is cisgender, it means that their gender identity who they know themselves to be is the same as the sex they were assigned at birth. And this is not meant as a label or a judgment or anything like that. It's just a more accurate descriptor when talking about this. The word cisgender exists to fill a gap that would otherwise exist in language, and that has been previously filled with words like normal or regular, which of course position people who are not cisgender as abnormal or irregular or weird as a result. And being cisgender, it's certainly more common, but use of words like normal, real, biological, those can have a really denigrating connotation for those of us who are not cisgender. Of course, when I'm talking about those who are not cisgender, I am alluding to our next term, which is transgender. So transgender means that someone's gender identity or who they know themselves to be is different than the sex they were assigned at birth. It's very broad. And please note just a little bit of wordsmithing here that the correct term to use is transgender, and it's not transgendered or a transgender or transgenders. You can say transgender person. And the term transgenderism is not really a word, and it's often used with the intention of pathologizing transgender identity and transgender people. So please don't use that term. However, it's generally acceptable to use the term trans as an abbreviation for transgender, as an adjective. And this is often used, especially within the trans community, like I just did. So they're all the transgender is the same thing, and cis and cisgender as well. So as I mentioned, the word transgender is, well, the definition is very broad, and this is why it's often thought of as an umbrella term, because there are many, many types of gender identities that can fall underneath it. So these two on the screen are perhaps the most common or binary gender identities, transgender identities. I don't want to say common, but they were previously thought of as such in our understanding of gender. So these two identities describe people who experience their identity within the binary as men or women. And formerly, there were some terms that were used like FTM or female to male and vice versa for trans women. And some people still use these terms, but the community has largely shifted away from these at the bottom in the past 5-10 years. It's very recent. Again, some folks still use them, but this is the ones with the check marks, trans man, trans woman, those are generally the most acceptable terms. And also, these terms AFAB, AMAB, which stand for assigned female or male at birth, are more accurate and generally acceptable to use, especially when we're talking about within a medical context or when it's pertinent information, which it usually isn't, but that is another term that's generally acceptable to use when we're talking about this. It's also important to note that while many transgender people identify within the gender binary as men or women, there are also many transgender people who do not. So the commonly used term to describe someone's gender identity that falls outside of exclusively either male or female is non-binary. And this has been a term that's coming up a lot in recent years. And it's true that the term non-binary is a relatively newer term, but I want to stress that the concept of humans experiencing their gender outside of male or female is not by any means a new concept. This is not new. This has been happening since the beginning of time. And while many non-binary people also use gender neutral pronouns, such as the singular they, them, we'll talk about that more in a bit with pronouns. And I realized that, especially with non-binary, it might be new information to some of you, but please remember that this is meant to be a starting point. And another thing I will say is that you do not have to completely understand someone's gender identity in order to be respectful and affirming of who they are. One moment. So switching away from gender identity, I want to take a moment to talk about sexual orientation, because people tend to conflate sexual orientation and gender identity all the time. And you know what? Guilty. I did at one point too. We didn't talk about it in the 90s a lot. These two words also do not mean the same thing, but can be viewed rather as intersecting aspects of our whole identity. I find that this part is typically something that people can struggle to understand when they're first learning. So if that's the case, please bear with me. I will do my best to explain. So to revisit, we know again that gender identity describes who someone is. Sexual orientation, on the other hand, of course, describes who someone is attracted to, romantically, emotionally, sexually, physically, however you want to define that. It describes attraction. So these are a couple of examples of sexual orientations. This is certainly not an all-inclusive list, but these are perhaps more common ones. Notice that transgender is not on this list. This is because transgender people can be any of these sexual orientations. Also, dating a transgender person does not make someone gay. In fact, being with a transgender person in a relationship or whatever doesn't imply anything about someone's sexual orientation at all. Again, this is because being gay and being transgender are not the same thing. Gay would describe sexual orientation, who someone loves, and transgender would describe someone's gender identity, who they are. My best, I love this little kind of way to sum it up, to simply put this, sexual orientation is who you go to bed with, and gender identity is who you go to bed as. And going back to gender identity. So for transgender folks, some of us may choose to go through the process of gender affirmation, which has also been known as transitioning. However, the word transition can be kind of misleading, as it implies having a start and end point. And although it makes sense on a basic conceptual level, it really doesn't quite capture the realities of what it's like to go through that process. So the word gender affirmation is more appropriate and accurate to use in this case. And gender affirmation means that the person is shifting away from their sex assigned at birth and towards their authentic gender identity. Keep in mind that there's no prescribed way to do this, and it's extremely dependent on the individual and their desires. Going through this process is also by no means a requirement for being transgender. It's important to remember that for many reasons, not everyone wants to or can go through this process. And lastly, when talking about gender affirmation, this can include social and or medical gender affirmation. that was my picture, by the way, kind of before and after my medical transition. So to talk about kind of the difference between the two, we'll start with social transition or gender affirmation, which refers to the process of letting others know your true gender and beginning to live your life that way. So that can include things like going by a different name, using different pronouns, and changing your appearance, like hair, clothing, makeup, age, gender expression. Yes, so changing the way you express your gender identity. Kind of a more socially related, hence the name. So medical gender affirmation can refer to usually these two things: gender affirming hormone therapy, or gender confirmation surgery. Again, some people do both, some people only do one or the other, and some people do neither of those things. With the first one, gender affirming hormone therapy, that's the acronym for it. It also used to be called HRT, which stands for hormone replacement therapy. So this utilizes testosterone or estrogen anti-androgens, depending on who you are, to change the person's secondary sex characteristics. So the best way to describe it, it's like going through a second puberty. It can take several years to see the full final effects of hormone therapy. And some people do this only for a short period of time, and some people do it for the rest of their lives. And that depends again on many factors, including health factors, etc. Yes. And the second one, gender confirmation surgery, which is the thing that people are always so curious about. So this used to be known as sex reassignment surgery, which hopefully, as we've been talking about these concepts, you could perhaps understand why sex reassignment surgery is not like the preferable term. So the purpose of this surgery is to align the person's body with their gender identity, of course. And there are many different kinds of surgeries and procedures and techniques that can fall under this classification. And again, it's extremely dependent on the individual and other factors. I do want to emphasize that undergoing surgery or any kind of medical transition or gender affirmation is not a requirement for being transgender. And someone who has not gone through medical gender affirmation is no less valid in their gender than someone who has. At this point, I want to shift our conversation to focus on transgender youth and adolescents because there are special considerations to address. A very common concern heard around transgender and gender diverse youth is, aren't they too young to know who they are? Well, we know that a child's internal sense of gender identity is usually developed by age 2 or 3, pretty young. They know if they're a boy or a girl. And then by age 5 or 6, children generally have an understanding of gender roles and those social expectations based on their gender or their assigned sex at birth, which can influence their behavior. So sometimes if they were displaying kind of cross-gender traits, they can sometimes learn what's socially appropriate and change to conform. So this is kind of the age of conformity to the expectations. But it's important to realize that, you know, just because a child conforms, it doesn't mean that who they are, like their core traits, have actually changed. It may just be their behaviors trying to fit in. Many transgender adults, definitely myself included, knew that they were transgender or somehow different from a young age, but did not necessarily have the words or the knowledge or the wherewithal to express our feelings at the time. This is a picture of my sister and I from Halloween in 1997. My sister's costume was the 50s lady, complete with the authentic poodle skirt. And then I, of course, am on the left with the ninja costume and the dagger and the blacked out tooth and the hood and whatever I got going on there. My point in showing this photo is to demonstrate that transgender children are not too young to know who they are. It's also important to acknowledge that, again, many children express cross-gender, what we consider cross-gender traits or behaviors or tendencies at different times during their development. And this does not necessarily mean that they are or that they will be transgender. So for parents, how can they tell, or educators or whoever is kind of responsible for the child at that age, how can they tell if, a child is transgender? A very simple, common guideline and sort of mantra used among parents of transgender youth is, if in regards to their gender identity, they are insistent, persistent, and consistent, then they may be transgender. Insistent meaning unwavering, persistent, continuing firmly in spite of difficulty or opposition, and consistent, unchanging in nature over a period of time. This is not meant to be at all a definitive test, but again, rather something to observe over time in order to provide the best guidance that is still affirming of their gender and who they are. Unfortunately, there are many transgender youth and adolescents out there who lack the support they need to thrive as their authentic selves. Rejection comes in various forms, of course, but this does include extreme measures like conversion therapy. Many organizations, including the American Psychological Association, the Substance Abuse and Mental Health Services Administration, as well as the American Academy of Child and Adolescent Psychiatry, have strongly asserted that attempting to prevent or change a child's gender identity in any form is ineffective and can be extremely harmful. Some examples of the ways that the trauma of rejection can manifest include psychological problems like depression, anxiety, substance abuse, and suicidal ideation or attempts. Some of these problems may become apparent immediately while they're still young, and some of these might not come to the surface until later in adulthood because repression is a thing. But at the heart of this, really any practice that pathologizes transgender identity and makes it into a problem or an illness often has long-lasting damaging effects because it's not a problem or an illness. And while younger children do not undergo any kind of medical interventions, it's critical for them to be able to express who they are and live in alignment with their authentic gender identity as early on as possible. I do want to acknowledge that realistically, it's not possible to prevent all of the problems a child may experience related to their gender identity in life. However, the good news is that most of them can be nipped in the bud through gender affirmation, and we'll talk more about that in a second, and also parental support. In a recent publication, the American Academy of Pediatrics sums it up wonderfully by saying, parental support and understanding are essential for a child's self-esteem, social involvement, and overall health as transgender. In terms of gender affirmation for youth and adolescents, there are 4 components. One is psychological. So this means that they feel that their gender is seen, validated, and respected by their parents, family, teachers, peers, etc. They're not shamed or made to feel guilty for who they are. They're not forced to explain or justify their gender identity to other people. So that's psychological. And then we have social gender affirmation. Yes, we've seen this one. So again, chosen name, pronouns are used and respected, and they're allowed to express their gender identity through clothing and hair behavior. So they're allowed to do the gender expression that best aligns with them, even if it's not something that we may understand. And then legal. Okay, so this might be a little bit later for older, adolescents, but name and gender marker changes. If they are old enough to drive, there's driver's license. If they're still underage, there is also state IDs, birth certificates, all these things. And I always tell people, or parents especially, that the younger this process with the legal stuff is taken care of, the better. Because when you're an adult, you have fun things like a credit score and taxes and employment history. So you could see how it gets kind of hairy the older you get and the more history you have. So definitely advise taking care of that as early on as possible. Lastly, there's medical gender affirmation. Now, 2 of these we've seen on here, gender affirming hormone therapy and gender confirmation surgery. I just want to stress that, again, really all of these are not done until adolescence, at least. So they're not being done. Medical transition is not for young children. Social transition, all the above are. So in recent years, there's been a lot of advancements in providing affirming care for transgender youth and adolescents. Unfortunately, of course, we've also witnessed the widespread, unsubstantiated, politically motivated targeting of gender affirming care for kids. Much of this controversy has stemmed from misinformation around the use of puberty blockers for transgender and gender diverse youth. So puberty blockers, as the name implies, pauses puberty and prevents secondary sex characteristics from developing in puberty age adolescents. And despite the myths and all, like I said, the misinformation that continues to be perpetuated around the dangers of gender affirming treatment, puberty blockers are 100% in fact safe to use. The Endocrine Society and the World Professional Association for Transgender Health, WPATH, support the use of puberty blockers for kids who want to delay or prevent these unwanted physical changes associated with endogenous puberty. And in general, the US Food and Drug Administration has also approved the use of puberty blockers in general for children who start puberty at a young age or too early. Another common concern just around puberty blockers is, well, what if they change their mind? Puberty blockers are also, in fact, reversible. So this means that even if the youth were to change their mind, despite having gone through the rigorous criteria to meet before even getting access to this type of treatment, which is becoming illegal in some states, apparently. That's the whole battle I was referring to. However, it is reversible. They can stop the treatment if they were to change their mind, and Their endogenous puberty, or what they would normally go through without intervention, would resume. Also consider that endogenous puberty itself is not reversible. And often people need surgery or vocal training, and some things can't be changed, like height. And often going through puberty is psychologically damaging to trans people, to go through that. And it's sometimes something that cisgender people may never quite understand. And lastly, in many cases, having access to puberty blockers and gender affirming care and treatment is often, quite literally, life-saving. According to the Mayo Clinic, there are many benefits to utilizing this treatment to delay puberty, including improved mental health, improved peer interactions, and it eliminates the need for future surgeries. For example, an adolescent trans boy who doesn't develop breasts will not require top surgery later on. Top surgery is chest reconstruction, mastectomy. In this final part, I'd like to talk briefly about how to be supportive of transgender folks in general, regardless of who you are. And I genuinely believe that these are things that everyone needs to and should know. I'm working on it. A bunch of us are. So many trans people, again, changed their names legally or otherwise as a part of their gender affirmation process. In more recent years, the trans community has been using the term dead name to refer to what they were named at birth, or their birth name. So dead naming someone would mean using their birth name instead of their correct or chosen name. Also, you should absolutely never ask a transgender person what their birth name or dead name was. This is a big no-no, but it's one of those, if I had a nickel kind of situations, and I am a very poor example of this because my dead name and, well, I don't really have a dead name. It's a birth name and my chosen name are pretty much the same. So I am like a bad example, but this is the case for most people I know who are transgender. So don't ask. And then regardless of the legal status of the person's name change, it's very important to use the name that the person tells you to use. I understand that in some situations, it may be necessary to list a transgender person's legal name on documents or whatever it is, but you can still refer to the person by their correct name when addressing them verbally or in any other way possible, just to be affirming. And then pronouns. This is a big thing. Pronouns, as I hope folks know, as this is at a library presentation, are how you refer to someone. And these examples on the screen are most common, but not all pronouns available. We know he, we know she. Let's talk about they, them. So they, them is the singular they, them is the most common, perhaps gender neutral pronoun. And there are a lot of other alternatives as well that folks may use. Similarly to the name, it's very important to use the pronouns that anyone or transgender people or anyone want you to use for them. I also want to say not only transgender people use gender neutral or they, them pronouns. If somebody uses pronouns other than what you would expect, it doesn't necessarily mean they're transgender. I'm going to get on my soapbox here for a second, and I want to give some tips around pronouns. This one is so big. I hear this all the time. Pronouns are not preferred. Although this may be well-intentioned, the word preferred implies that it's optional. I'll speak for myself as a trans person. I mentioned that I use he, him pronouns at the beginning when I introduced myself, or the third slide in. Those are simply the pronouns I use. I don't prefer if you call me he. Like if you don't, I'm going to correct you. Like or not respond because I won't think you're talking to me. So those are my pronouns, nothing else. I don't prefer them. So as you can see, that's why it's just pronouns. Gender pronouns, sure, just pronouns. Now, you may be thinking, Nikk, you look like a man, so of course, why wouldn't I call you he? While this may be true, you cannot always tell what someone's pronouns are just by looking at them. And this is why I've put into practice introducing myself with my name and pronouns. And I would encourage folks to do the same, regardless of your gender identity, if you're cis or trans or whatever. Even if it's a name tag or email signatures, I see a lot of that. That's great. It's really creating an environment where people feel like they can be their authentic selves, even in a professional realm or whatever. Having said that, how do you know what someone's pronouns are if you can't tell just by looking? This is when asking respectfully would be the right move if you aren't sure. My go-to phrase when I'm not sure what someone's pronouns are, which happens all the time because I know a lot of trans and gender diverse people, I say, may I ask what pronouns you use? And 9 times out of 10, people are not going to get upset about that question. They may be confused if they're not transgender, but you probably wouldn't be the first person to ask them if that's the case. So yeah, it's generally acceptable to ask somebody respectfully, can I ask what pronouns you use? Of course, with the intention of, I want to address you the way you want to be addressed. That's simple. Sometimes you will make a mistake and accidentally misgender someone or use the wrong pronouns to refer to them. Now, most trans 101s would tell you to apologize and move on and don't make a big deal out of it. Yes, that's good. I would also like to take it to the next level and encourage folks to say, thank you for correcting me, or just say thank you. Repeat what you said with the correct pronoun and continue talking. All too often, I feel like people get really caught off guard when they're corrected and they feel embarrassed or they get defensive or explain like there's no tomorrow, or over apologize or make a lot of excuses. Oh, I'm learning. Oh, I'm trying. Oh, yeah, all that. That's why I'm like, simple thank you for correcting me. He, and then continue what you were saying. Like, don't just stop talking. It's a sufficient and effective way to address this without doing all that or feeling embarrassed, because everyone makes mistakes. I want to end here with my top 6 tips for being a transgender ally. So number 1, you don't have to understand someone's gender identity in order to respect that, in order to respect it. And I love it so much, I put it in here again, because that is such a powerful thing to keep in mind, especially when first learning. Number 2, someone's transgender identity is their private information to share or not. And just because someone has told you that they are transgender does not mean that they want to tell everybody in their life that they are transgender. It could be because they don't feel safe to tell people or a certain person in whatever given situation. They might, feel they'll be mistreated, or, they don't want to share that information just because they don't. It's private. And you can tell people I'm transgender because this is my job. Me personally, just me. I'm giving you permission. Number 3, there's no one right way to be transgender. Some of us medically transition and some don't. or socially and or not at all. And some transgender people may want to do those things, but they can't because of, safety reasons or health reasons. And really, again, a transgender person's identity does not depend on what things they have or have not done to transition. Number 4, going back to pronouns and name, just use the pronouns and name that people ask you to use, even if it's different on a piece of paper. It's more important to respect the person than respect the paper, right? And we talked about some ways around that if it's necessary to use a person's legal name that may be different. And also with the pronouns asking respectfully, you can also share your own pronouns too. That's another way to ask, like, my pronouns are, whatever, and then what are yours? What's your name pronouns? Very standard practice, believe it or not, where I work. Number 5, continue to educate yourself. There is a lot of information out there available now more than ever. Libraries are a great place as well. Books, yes, internet as well. A wealth of knowledge, whether it's from people who are not transgender, writing about trans people, or even better, people who are transgender, like me, sharing about their experiences straight from the source, the primary source. And lastly, no one is perfect. Keep trying. The transgender community is extremely diverse and everyone's experience is different. My experience does not represent everybody's experience in the community by any means. The most important thing, again, is that you're respectful, do the best you can, and keep trying. And with that, I'd like to move into the Q&A. I'm not sure who we have here because I have my screen up. But before we do that, I just want to mention that I am available for questions or inquiries. You can visit my website, transgenderseminar.com, or email me at transgenderexpert@gmail.com. Happy to discuss anything afterwards. So I'm going to close out of my screen here. Oh, it's just you guys. Well, that's
okay, because I actually have some questions for you.
Yeah, please. Yes, I'm like, feel free.
This is something that came up at work about, a week or two ago, where the head of our circulation department said that when people say, this is the name that I am using, and this is what I want my library card to be, even if that's not my legal name, they're more than willing to put that on their library card. But then we started talking about kids, minors, who would come in and say, but my name is, my name is Marissa, but I go by Emil. And she was saying, well, that's fine, that's not a problem, but any mailings that we send because you are a minor that are going to your home are now going to be coming under the name of Emil. Is that how you want your parents to see it? And so we came up with the solution. I don't know if it's a good one or not, but the solution was that the card would be made in the name of Marissa, but there would be a note in the library card in their notes field that said, please address this patron as Emil. This is how this patron prefers to be addressed. Is that reasonable, or is that unreasonable? Is that a good idea?
Yeah, no, and I could definitely appreciate, not wanting to just change it over and assuming that everyone knows that this person goes by Emil. You know what I mean? Like, that could be potentially outing,
Right.
young people to their parents or family. So I think, provided that, the library staff are actually heeding those notes and acting accordingly, I think that is really a great solution as it tailors it to, like, when they're in the library, it's a safe space, they'll be called, what they want to be called, and and then it avoids any kind of or even if the parents do know, you don't want them to be like upset or like, no, that's totally, I agree with that. I think that's actually a good workaround for that.
And then my other question is, some of the kids that I work with who are trans have gone through multiple name changes, which I sometimes have a difficult time keeping track of, to be completely honest. So there are times when I will refer to Emil as Alex, which was what he was going by before. And I'm always like going, oh man, I'm really sorry. I don't know what else to say about that. Is that the only thing I can say?
I get it. And, it can be kind of a process, especially if somebody's pretty new to, being out as trans and starting to live that way. It's almost like if you were wearing the wrong pair, the shoes on the wrong pair of, like, switch your whole life, wrong feet, and then you finally are like, okay, I'm gonna get some new shoes, and you try the first pair on, it's like, wait, this is better, but it's not quite wide. You know what I mean? And I understand how it can be confusing. I've had that happen as well especially with T-Mac and adults coming out doing the same thing, full grown adults. And it's just a matter of allowing that growth, and hoping that they find, what is best kind of suited for them and sticking with that. But I hear you in that. And I've definitely been like, Noah, Charlie, shoot, I forgot where you're going right now. Like, I hear that, but it's okay. And I think that the importance is, like, you're calling them at least by the name that that it's not their dead name. Like, you're
Right.
at least going for that. And I feel like the incorrect, like, a previous chosen name is better than like a dead name. So it's like not like, an offense in that way. So yeah.
Mistake that I find myself making is sometimes, without even thinking, saying yes ma'am or yes sir, and then I'm just wrong. I'm just wrong.
Same.
And
Yeah.
so, and I am not normally called out on that, but I always feel really bad about that and try to say, oh my gosh, no, I'm so sorry, that was wrong. I don't know what else I can do about that either. I think that's about it, right?
Yeah, yeah, I think it's a lot, because especially when you work with the public, it's like we're all conditioned to, that's respectful, right? Like, sir, ma'am, like, yeah. And I think, it's kind of an evolution of, I feel like, as our society kind of socially, professionally evolves away from being so gendered, it's really kind of a process of making a conscious effort to change, like, to just use more gender neutral language when possible. And look, I'm from Michigan. I say, you guys, there could be a whole group of women, like, you guys, like, it doesn't matter. But the way it was put to me is that there could be, a whole group of girls, and then one's a trans woman, and that's just like the you guys, and it's like one more thing, like, oh, I'm getting called a guy again, just for that person. So that's one that I am still, like, trying to catch myself from saying. And there are a lot of I go on LinkedIn a lot, and I've seen a lot of resources about just kind of with companies switching over to just more less gendered language. But yeah, I want to agree, like, when you say yes sir, or I used to work on have a phone job, so I just stopped using gendered language altogether. Like, everything was they, even if it was like the most feminine name, I knew, was pretty certain this is a cis woman, I would just say they for everybody in my, like, notes and stuff. So
Okay.
almost defiantly.
That makes sense. Because I have a friend whose signature on her email is this sounds like it's just wrong all the way across. My preferred pronouns are she, her, but anything is fine.
Well,
so I don't know if that's a good thing, or that seems almost like, yeah, whatever, but I don't know.
well, I see both sides of it because some people really don't care. And I think that like in some cases you can have a preferred pronoun if there's multiple options. I should specify. If you, for example, my supervisor at work uses he, they pronouns. So I asked him, do you have a preference between, those, like of what I would call you? And sometimes it depends on like where you're at with the person. Like, well, around my family, call me he, but if we're friends, you say they or whatever. And that, so you could have a preference. And again, if this person, is not transgender, I see both sides of it because like it's good to kind of lessen our attachment, I think, in general, whether we are cisgender or transgender, to the whole I'm a woman, I'm a she, or whatever, like be so attached to pronouns and like that kind of language. But at the same time, pronouns are important to trans people, or like I'll speak for myself, like it is important for me to be called he. And I know folks will use the like they for any trans person. I've met people that, although well-intentioned, will just call all the trans people they, because I know it's hard to keep track. Sometimes there's variation, but to me, I don't like that, because it's like like somebody would be like, oh, he, and then find out I'm trans, and like, oh, they. I'm like, well, that now you're changing your like perception of me. So let's pretend I didn't tell you, just pretend you didn't know. So yeah, that's like kind of multiple perspectives, but I think overall, like the preferred thing, that's a little nitpicky, but I think my point more with that is just, it's not like, oh, pretend he's a he, like, or she's a, it's like those, for some people, it's like, those are my pronouns, non-negotiable. I hope that makes sense.
Great.
Did you have questions, Kat?
No, but I really thought it was a really good talk. Thank you so much for doing that.
Yeah, thank you. I did want to request from you two, when you get a chance, if either of you or both of you even would be willing to write like a brief blurb about my webinar, or like just say what you thought for my website. I'm just showing little reviews. That would be wonderful. Just email that to me when you get a chance.
Oh, yeah, sure. We can do
Yeah,
that.
thank you. I just want to show people like, look, people like it or hate it.
Oh, it was
No one's
great.
hated it though.
Okay, my husband was here and he took, these are his notes. So filled up an entire page with notes.
Very nice.
Yeah.
Good. I'm glad folks are learning.
Yeah.
It's hard. I do this so much, and I sometimes feel like people know this already. And then I talked to my mom about that. She's like, Nikk, people don't really know this stuff, and it's like so old hat to me that I feel like I'm being like, condescending or like patronizing. But I'm like, no, people really don't know this, and I gotta keep them.
No, it's really good. It was definitely worthwhile. And I'm glad I was here.
Yeah, I'm glad. Yeah, I'm glad.
Yeah.
Yeah,
All right.
well,
Anything else, you guys? Oh, you guys, there you go. Anything else?
I know. I do that all the time. It's
Trying to use people.
I think it's a Midwest thing.
It is because my husband's from Mississippi and everything's y'all this, y'all that.
I was just gonna say, if it was Texas, we'd all be going y'all. So.
Y'all, yeah. I started saying I just blame it on my husband. Take up his Mississippi stuff.
Are we done then? Do we think we're
yeah,
great?
I think so.
All right, we will send you something within the next couple of days, both of us. And thank you so much for it was really valuable. I found it really great.
Yeah, very cool.
Thank you. Awesome. Well, have a wonderful night, and it's very nice to meet both of you.